Good afternoon and welcome to Review and Republish Your DSPT. My name's Alan Wilmot and I'm going to be running through the session this afternoon on behalf of the Better Security, Better Care team. But before we start, we'll just wait a few moments to ensure that everyone who's joining us is able to log in okay. So just give me a few moments and then we'll kick off. Okay, so hopefully most people have joined us now and we'll get into the programme. But before we start, I just want to run through a few housekeeping points. So let's just have a look at the bullet points on the screen here now. So this session is for care providers who have already published their DSPT in the past. Although, of course, we are aware that some of you may not have been the person who published it last time. So if you do have any questions, please follow the guidance that I'll be sharing shortly in terms of how to get those questions to us. Most importantly, to put your mind at rest, attendees are on mute and can't be seen. And we would ask that if you do have questions, that you use the Q&A function. So if you're viewing on a phone, you need to tap the screen to see the controls, choose more, and then Q&A. And any questions that you do have come back to you, assuming that you add your email to the Q&A so we know who the questions come from. And again, just to reassure you that the webinar will last no longer than 1 hour, and you will get access to the presentation, which includes the links that we'll be referring to. So with that out of the way, there's just one thing I'd like you to do for us. So before we look at the agenda for the session, we'll be really grateful if you could just answer a few questions for us so we have an idea of who's here, where you are on your DSPT journey. So 4 questions there. What level are you at? Have you personally used it before? Are you single site or multi-site organization? And where did you hear about the DSPT webinar? So just click on the appropriate response. And then when people have all responded, we can see what sort of audience we have with us this afternoon. Okay, so hopefully everyone has now responded to the 4 questions, so we can see a quick summary in terms of where people are at. Okay, so we've got no one at entry level, 10% at approaching standards, 80% at standards met, and 10% don't know. Right, well, that's really encouraging. That means that most of you have published at standards met previously, that most of you have actually used the DSPT before, and that about a third of you are publishing for multi-site. So that's helpful in terms of getting a view of who's attending this afternoon. So let's move on to have a look at today's agenda and what we're going to be covering. So we're going to be starting with logging into the DSPT prior to reviewing what you've got in there and what's transferred across. We're also going to spend a short period of time looking at what's changed on the DSPT. So if you haven't looked at the DSPT since you last published, there will be a few differences. How you then republish your DSPT before finishing off with some tips and guidance, sharing again what support is available, and then we'll be finishing off by allowing an opportunity for any questions that you might have before rounding off the session. So before we start within the agenda per se today, what we thought we would do is just have a quick reminder and an overview of the DSPT by running a short animation for you.
Better security, better care with the Data Security and Protection Toolkit. As a care provider, you store and share important and often sensitive information. This includes data about the people you support, their family and carers, through to staff, partners and funders. To store and share that information, whether it is on paper or digitally, all care providers must have systems in place that reduce the risk of cyber attacks and information breaches. If you don't, your business and reputation could be at risk, and you could be breaking data protection law. The Data Security and Protection Toolkit, or DSPT, is an online self-assessment tool. You can use the toolkit to check your data and cybersecurity policies, procedures and practices, and demonstrate that you have good systems in place. This can reduce the risk of a data breach and the risk of a fine if a breach occurs, as you will be able to show the Information Commissioner's Office the steps you are taking to reduce and manage risks. All adult social care providers in England, regardless of size, service type or ownership, should complete the DSPT at least once a year. When you have completed the toolkit, you can publish and share information about the standard you have reached. So what levels can you reach on the DSPT, and what do they mean? There are currently 3 levels on the DSPT. Approaching standards means you are meeting minimum legal standards. It's a temporary stepping stone to the next level, and you will need to produce an action plan to show what you will do to get 2 standards met. Approaching standards also enables you to get NHS mail, an accredited secure email system, which helps you to share confidential information with local authority, NHS, and other colleagues. Standards met is the level you really need to reach. It demonstrates that you are going above basic legal requirements, and it helps you to take some proportionate measures to protect you from cyber criminals. It will help you to reassure people who use your services, their families, and your staff that you are managing their information safely. It will also enable you to answer the Care Quality Commission's questions about managing data. And if you are accessing NHS patient data or delivering services under an NHS contract, you must have reached standards met. Local authorities are also increasingly asking for the DSPT in their contracts. Standards met opens up access to shared systems with other health organisations, including GPs, hospitals and pharmacists. These systems can improve decisions you make about someone's care and save your staff time. Finally, standards exceeded indicates that you have gone beyond required standards. So, for example, you may have Cyber Essentials Plus in place. As a care provider, you should complete the DSPT at least once a year, but we know that not every care provider feels confident about using the toolkit. To support you, the NHS-funded Better Security, Better Care programme provides direct support, as well as useful guides, templates and a helpline to enable you to publish your DSPT and to protect the vital information you store and share. To find out more, visit www.digitalsocialcare.co.uk/better security, better care.
Great. Okay, so as I say, the video was there as a reminder and overview in terms of what the DSPT is about and how it can help you. So let's have a look at the DSPT journey in terms of a little more detail. So having previously published, the process is relatively straightforward to republish. So as we can see here, the first thing you would need to do is to log in. Then you review and update your existing answers. One thing that's different with republishing is that when you publish for the first time, we advise you to answer all of the questions in order to reach standards met, not just the mandatory ones. Having published, though, when you go to republish, the only questions you need to respond to are the mandatory questions, because the view that you get of the DSPT is all of the DSPT, not just the social care view. So you need to be keeping an eye out for the mandatory questions when you republish. And just a reminder again that the DSPT year runs from June to June, and that you are required, as we saw in the video there, to republish at least once a year, although there's nothing to stop you dipping in and out of the DSPT in order to update as you go through. So As I mentioned earlier, some of you may not be the people who have done the DSPT previously, so some of it may not be clear to you. So I just want to highlight what support is available to you in relation to completing and republishing. So the Better Security, Better Care team are available, and they provide national support and resources. And there is also local support available as part of the Better Security, Better Care programme from your local support offices. And we have access to a range of template policies and resources. And all of that is free and official. And there is online guidance available on the Digital Care Hub website. And that includes step-by-step films in terms of how to do it. And then, of course, we obviously run the webinars. There's a series of frequently asked questions, template policies, as we said. There is also a helpline, and most of the LSOs will offer support over the telephone or online. And so within each of the local areas, there is that local support partner there available to help you. And you'll see the website, Digital Care Hub, available on the bottom of the screen there. So that's what's available and why we need to be doing it. So let's move on to the how do we do it. So the first thing you need to do is to log on. So you go to the website that's listed at the top of the screen there, dspttoolkit.nhs.uk, and you log in simply with your email and password. So that's the email that's registered with the toolkit and the password that was used when the organization's profile was set when the DSPT was last completed. Should you experience any login problems, either because you don't know what email address was used or you can't remember the password, you can contact the help desk on the telephone number that's on the screen, or by emailing Exeter, as again indicated on the screen. So what does it look like when you go to the website? Login process is fairly straightforward. We'll be familiar with you, and it's simply a case of entering the email address that's registered with the DSPT and the password that was used to set it up initially. And you can see that if you can remember the email address but you've forgotten the password, there is a forgot your password option available next to the login button. And you'll see on the right hand side of the screen that it does give you the option to log in with NHS Mail. However, if you do log in with NHS Mail, then it will require you to log in with NHS Mail in the future. So that may not be the best option for you. So if we then have a look at what you see once you've logged in, it will look like this. And if you've not visited the DSPT since you first published, this may look different to what you saw before because it's not the social care view. It will show you all of the DSPT questions. So you can see the blue banner there asking you to complete your assessment for the next year, whatever that might be. And you'll see on this occasion, you've got a progress bar that indicates how many of the questions have been completed. It may be that some of the questions haven't transferred across. That's for a host of reasons. Either the questions have changed, or it may be that the system has thrown a glitch. So you do need to check the progress bar to see how many of them are showing completed next to them. As I mentioned earlier, this time you only need to answer the mandatory questions. They are the same 42 questions that were in the social care view that you published the first time, and they're still grouped into 4 sections. So this is the view that you get if you are publishing for a single site using the VODS code when you completed the first time. For those of you who completed previously using the HQ code and therefore published for a number of sites, it does look slightly different. So you've still got the blue bar across the top telling you what year you're publishing for, but you'll see underneath that it says this is an HQ assessment. Publishing this will publish for the selected branches, and then there is the blue link to drop down the box that indicates the branches that you're publishing for. So you can tick or untick those branches as you wish. if you're publishing on behalf of a larger organization or a multi-site organization. And just a reminder that if you are a multi-site provider, then you can, of course, publish one DSPT that covers all of the branches and locations, with the proviso that you use the same policies and procedures and that all arrangements around data and cybersecurity are the same. So, how much work do you need to do in order to republish? That will depend upon what level you published at previously. So if you published at approaching standards the first time, then the process is the same. You still need to review and update your existing answers, but you will need to complete all the remaining mandatory questions in order to reach standards met. Again, just as a reminder, you cannot publish at approaching standards more than once. So you will need to move to approaching standards or standards exceeded this time. If you published previously at standards met, then it's simply a case of reviewing and updating your existing answers. And I just want to emphasize the importance of making sure that you do read through the questions to make sure that it still reflects the reality as it is in your organization currently. And again, if you published at standards exceeded, which I don't think any of you indicated on the poll at the start of the session, then it is again just a question of reviewing and updating your existing answers. So let's have a quick summary of the key points that we've covered so far. So your previous answers should still be there, as I say, unless there has been a change to the question, a change to the legislation or regulation, or indeed if for some reason the system wasn't happy with the question you put in previously. And again, it will look different to what you've seen before if you've only seen the social care view. Don't panic. The assessment view still includes all of the DSPT questions that you answered previously, but they are the ones that are now marked mandatory. So it's simply a question of going through the same questions that you published on last time and making sure that you've got the up-to-date and current information relating to your organization. So I mentioned earlier that the DSPT year runs June to June. And each year the team will review what questions need to be in this toolkit in order to reflect the current requirements, etc. So if there are changes to the DSPT, don't panic. And indeed this year they have just published changes to the DSPT. So let's have a look at what is available in terms of the changes for the future. Right, if you're publishing for a multi-site, they have introduce some new processes that make it easier for you to publish on for multi-site publications. So there is now an additional screen when publishing displayed to organizations that are not flagged as HQ but previously published on behalf of other sites in their last publication. The existing functionality with HQ and the sites is unchanged, so you still be able to do what you did before. And where a non-HQ organization that had sites added to their last publication selects published assessment, the additional screen will be shown, as you can see on the screen here on the right-hand side, where it says, would you like to publish for any other organizations or branches? And a drop-down screen again will drop down so that you can choose the ones that you might wish to publish for. More importantly, new changes this year that have been brought in are that an additional question has been added to the IT section, and that's question 453, where it asks about multi-factor authentication. This is a question that's a tick box response, but it does require ensuring that you've done all you need to do in order to be able to respond positively to that question. So multi-factor authentication, or MFA, is deemed to be one of the most effective ways to protect your data and your accounts. So you need to be thinking about all the systems that can be accessed from the internet, such as your email, digital social care record, cloud-based systems, online systems, and either ensure that all of the user accounts are protected with MFA, or detail any exceptions in the text box response. So whilst I say that it is a tick box question, there is the opportunity to enter comments as with all of the tick box questions on the toolkit. If you are not sure about multi-factor authentication, then there is more information available on the Digital Care Hub, and they are continuously developing further guidance in terms of how to work with that. So why have they introduced this question? As I said, it is considered to be one of the most secure ways of protecting accounts that are using personal and confidential information that you want to keep secure, etc. And in reality, this is probably familiar to most of us for use such as bank accounts, etc., where they use multi-factor authentication. So it shouldn't be a big step. However, what you do need to do is to make sure that it makes sense for your organization. So what are they asking you to do? So what they would like you to do is to review your current systems and speak with your suppliers in terms of whether or not MFA is feasible and advisable. Identify any potential issues. So for example, have you got staff sharing devices or logins, the sorts of things that can create vulnerabilities? So therefore you're in a position to be able to identify where implementing MFA might be appropriate, but also where it might not be appropriate. So if there are already other significant controls in place, then it may be a step beyond what you need to do. So the important thing here is that you need to ensure the balance between the security of the systems that you're using and maintaining their usability, because we don't want to put people off actually using them. However, what they are suggesting is that any systems that you decide that don't require MFA, then you need to be noting that at a senior level in your organization with an explanation as to why you feel that. And that's really quite important in terms of, should there be a data breach, then you will be able to show that you have still carried out due diligence in relation to that. So that's the only new question this year that you'll come across in the toolkit. So thinking about this issue around not going overboard, maintain your systems as being usable and don't add too many layers that mean people either stop using them or find workarounds, as we have a tendency to do. So identify the appropriate level for each system you use based on the sensitivity of the information, bearing in mind that that's what this is all about. It's about protecting the information of the people that you support and employ and ensuring that we do everything we can to prevent that getting into the wrong hands. So where appropriate, MFA should be implemented for all individual logins to systems. And if you're not sure, there is support available in relation to implementing this from your local support organizations, your software suppliers, or your IT suppliers, etc. So having reviewed the questions and responded and updated as appropriate within the toolkit, you should be in a position to republish. So let's have a quick look again at the process that we need to go through. So it's obviously the starting point is to log in to your existing toolkit. Look at the toolbar, see where it is in terms of which questions are up to date and which has been carried forward. Check each of the questions to make sure that what's within the toolkit still reflects current reality, making sure that you've completed all of the mandatory questions within the complete toolkit. And again, just a reminder that the DSPT year runs from June to June. So quick reminder of how it all works. So you're looking for the mandatory questions this time round. You may leave all the other questions blank, although of course, if any of them can be answered and you want to answer, there's nothing to stop you doing that. And indeed, you may be able to reach standards exceeded if you answer additional questions. But in order to publish at standards met, it's just the mandatory questions. So a reminder of how the questions work, you would click on the evidence item, which is the blue text, in order to expand the question, and then you can review and update your existing answers. So if you then click on the text, this is what you will see. So for this particular question, you can see it's a tick box on the top left there. So all it's requiring you to do is to read through the question and confirm that you have an up-to-date record of staff, volunteers and their roles, etc. And a reminder that the comments box can be really useful. So if you think it may not be you publishing the toolkit in the future, you can add additional information into the comments box, such as where that list might be, etc. So if we look at a completed question that is the same question, but now with the answers. So do you have an up-to-date record? Yes. And here we've used the comments box just to say where it is and how you would access that, which may be helpful for the person completing the DSPT in the future, or anyone new coming into the organisation who wants to check what your data and cybersecurity processes are. So another quick look at what we need to do. Once we've done that, we can publish, but I would suggest that we can revisit the DSPT anytime during the year as things change. So if you switch to digital social care records, for example, it may be worth just revisiting and making sure that your responses are current, etc. So how do you actually publish your DSPT? Well, once you're sure that all of the mandatory questions are indicating completed on the right-hand side, if you scroll to the bottom of the page, then if you are a single site organisation, then there will be the blue bar at the bottom that you can then just click on, which will publish your current DSPT and update your records on the DSPT website. Remembering, of course, that the only thing that's published is your DSPT status and the date that that status was achieved, not the responses that you've put into the toolkit. So if you are publishing on behalf of an HQ site, then again, just a reminder to check which sites you're publishing for and make sure that that's still reflected by clicking on the View Branches tab that's available there and checking through the list to make sure that the ones that are included have the same policies, procedures, IT systems, and the same data security arrangements. And then all the ones that you've ticked, you can publish on behalf with just the one submission. So what happens if you get the dreaded box of problem? So it tells you here that these questions have not been completed appropriately. It may be that you've missed a particular question, or it may be that you've entered your response in the comments box rather than the text box, in which case the system won't recognize that the question is completed. However, by clicking on the links that are within the box shown here, then it will take you to that particular question so you can check what the particular issue is. So again, once you've made sure that all of them have got completed against them, you can then scroll down to the bottom and publish on behalf of either your single site or your multiple site organization. So having published, you will then receive confirmation of the fact that you have published. So it will say when you've published, who you've published for and on what date. And that could be used as evidence of the fact that you have actually published. So not a complicated process, fairly straightforward, particularly if you've used the DSPT before. So in summary, just a few useful bits in terms of working with the DSPT. So once you're into your toolkit, if you use the admin tab on the toolbar, it allows you to manage the access to the toolkit. So this can be used for multiple reasons. You can add people who you want to add and edit evidence. So you can make them a member, in which case someone with specific knowledge. So perhaps your IT support, you may want to get them to respond to the IT questions, such as the MFA question that's just been added. So you can make them a member, and then they'll be able to add and edit evidence in the questions appropriate. Or you could add viewers, so if you were a multi-site organization, you wanted people to see what your organization has committed to in terms of the DSPT, you can make all of your registered managers viewers, and they can look at your submission online in order to do that. However, even if you don't make people viewers, you can make sure that people can access the content and the responses that you've given to the DSPT, because you can download the questions and responses as an Excel file. So once you go into the toolkit, you can see underneath the View Previous Publications, there is a Download Assessment tab available. If you click on that, an Excel file will download onto your device straight away. Or alternatively, you can save your responses as a PDF file. So again, if you go into the toolkit and you click on View Previous Publications, it will then give you the opportunity to view details, as you can see on the right of the slide there. And then if you click on that, you can save as a PDF. And just a quick reminder that every time you publish, you can download your certificate by clicking on the Download Certificate, which is underneath the View Details tab, which you can then use as evidence of the fact that you have published. In order to save your published DSPT as a PDF, so if you click on Control and P, it will open up the box that you see on the slide here. And then if you click on Save, it will enable you to download that as a PDF, which you can then share with those that you might want to. And that's a really important point, that once having gone through the effort of completing your DSPT, I would suggest that you need to make the most of it. So it's about then sharing that information with the people within your organization, ensuring that they understand what your organization has committed to in terms of keeping the information that belongs to the people that you support and employ safe and secure. So if you've got multiple sites, tell the branches that you've published, maybe give them a copy of the responses that you've put in it. Tell the registered managers. You might, as I said, might want to give them access to the toolkit in order to review it. Download the certificate to prove your DSPT status either as an organization or as a single site. And you may want to consider stating on your website that you have published the DSPT, because you want people to know that you take the security of the information that you hold about people safe and secure. So it's really important that you tell commissioners, including the ICS, tell your NHS partners and your IT suppliers as well, where you're at and what you're doing with the DSPT. So just a few tips in terms of making it real. Keep your DSPT up to date throughout the year, as I said earlier. It makes it easier to republish, but also it ensures that it still reflects the current reality for your organisation. But more importantly, make sure that your managers and staff understand what's expected of them in relation to data protection and cyber security, and make sure that they're following the guidance that you've put together. And you may again want to make sure that people can access the information by making a printout of the documents and related policies and procedures in a manual, which again can be useful for CQC. And remember that CQC's new process now also includes expectations around data and cyber security and the DSPT. So having said all of this, just want to finish off by saying that remember that you are not alone in this process, that there is free expert support from the Better Security, Better Care team, including your LSOs. So there is that full program of support that we looked at earlier. There is free and official. It is recognised by the Department of Health and Social Care and the NHS. There is that online guidance, the webinars, frequently asked questions, template policies, etc., which we can have a look at now in terms of what sorts of things are out there for you. So for approaching standards, the required policies are the list that's up there on the screen. I'm not going to read through them all, but you'll see down at the bottom of the list, there is a Find Template Policies link there that will take you through to the Digital Care Hub, where you'll be able to access any of those that you're not sure about. If you discover you haven't got any of them, or you want to check your current policies against a template. For standards met, there is the additional policy requirements there. And then there is the recommended documentation, all of which are available as templates on the Digital Care Hub. So if you don't have a breach incident reporting form, you don't have a mobile devices assignment form, smartphone policy template, or a template suppliers list, all of that is available free and easy to access on the Digital Care Hub. So where can you get further guidance should you need it? Well, There are links on the slide there through to the various sections. So if you need anything around staff and workforce, such as staff guidance or training for your staff around data and cyber security, that's available there. There is guidance on managing software suppliers who process personal data. There's guidance on document retention and disposal. And then if you just want to improve the security within your organization, there's a host of guidance available on things like passwords, antivirus software, etc. Mobile devices, the national data opt-out, all of the things that maybe you're a bit uncertain about, there is support and guidance available, but either by contacting the Better Security, Better Care local support partner or visiting the Digital Care Hub website. So that's how to work through the republishing and how to access your local support partners and the support that you might find helpful. What do you need to do next? Then I would suggest that the thing you need to be doing is checking out the guidance that's on the Digital Care Hub to make sure that your organization is current and doing what you should be doing in terms of best practice. If you want to contact your local support partner, the links there are available to you. So I'm going to stop rabbiting on there and just open up an opportunity to see if there are any questions that haven't yet been responded to.
Yeah, just a couple of questions,
Okay.
Alan. Let me just scroll up, sorry, in the chat. If the toolkit for version 6 was published in June 2024, how soon do they have to publish, to update to republish?
Right, so the latest version of the toolkit has recently become available. So if they publish before that, they have to publish before June next year.
Perfect, thank you. And then another question was, how does a small provider complete a penetration test?
That's not a mandatory question, so you don't need to respond to that. You can leave that blank.
Okay, fab, thank you so much. And that's the last of the questions.
Okay,
We
thank you.
sorry, we also have some guidance on business continuity planning, which might be useful. So I'll send that to the person who asked that question as well, in case that's helpful.
Okay, yep, brilliant. Okay, so just before we finish then, just one last request. Again, if we could just ask you a few questions in terms of how we've done, and that will help us then to plan our sessions for the future. So if you wouldn't mind, again, just completing the poll, which is for care providers, in case we've got anyone who aren't care providers here. So again, same process. If you wouldn't mind just clicking on the appropriate response, and then I can have a quick look at whether or not I've terrified you all or whether I've been helpful.
Just while the poll results come in, someone else has asked for the business continuity plan guidance.
Okay.
So just to say, I'll send it with the slides and the webinar recording afterwards for everybody.
Excellent. And just for those of you who may not be clear whilst we're waiting, obviously you do need to check as part of your business continuity planning, you have covered data and cyber security and what might happen. Again, it's increasingly important as we move into digital social care records and enhanced digital solutions, etc. So it's very pertinent. Okay, so have we all responded now to the appropriate questions so we can see how we've done this afternoon? Okay, so 80% of you have increased confidence, 20% no impact. So that means you're probably already fairly confident in terms of what you needed to do. 80% say you are very likely to complete and republish, and 17% likely, 3% unsure, and I'm guessing that's probably because maybe someone else completes the DSPT for you. And if you will contact your local support organisation for help, about a quarter of you will do. No, about 70% of you will. Excellent. They are there, they are willing, and they are very competent. So please do take advantage of that whilst we're available and whilst we're offering to do that. And then 90% of you would recommend the webinar. Excellent. Thank you very much for that. So it just remains for me then to say thank you very much for attending this afternoon. Thank you for cooperating with the polls, and I wish you the best of luck with your DSPT republishing. But don't forget, there is help out there if you get stuck. Thank you all very much indeed.
Amazing. Thanks so much, Alan. Take care, everybody.